test, test, test was the advice from the World Health Organization back in March. But it was dismissed by some in charge of the nation's health as inappropriate for Britain. 6 weeks later, there are testing stations all around the country. Those using this one in London today convinced it is the way to beat the disease.
I had a little bit cough, but I just wanted to be 100% sure that, even if I'm asymptomatic, I'm not affecting anyone.
It's the right thing to do, really. You know what I mean? To stop the spread of it.
Tonight, Matt Hancock, who'd set the goal of 100,000 tests, said he'd surpassed even that.
I knew that it was an audacious goal, but we needed an audacious goal because testing is so important for getting Britain back on her feet. I can announce that we have met our goal. The number of tests yesterday, on the last day of April, was 122,347. This unprecedented expansion in British testing capability is an incredible achievement.
He says contact tracers are also being recruited so others who are infected can be tracked down.
The combination of contact tracers and new technology through our new Covid-19 NHS app will help tell us where the virus is spreading and help everyone to control new infections.
Then a recognition that the lockdown has been oppressive, albeit necessary. The aim now?
To target the measures that are needed with much more precision. And so to reassert, as much as is safely possible, the liberty of us all.
Some, while welcoming his announcement, remain sceptical that the figures for testing give a true picture of what's going on.
Increasing testing is an important milestone, but it's not quite 100,000 tests being carried out because 39,000 tests have simply just been mailed to people's homes. That's not quite the same as carrying out a test.
One public health expert says what matters is not the numbers, but how good community tracing is in practice.
The 100,000 is an absolutely meaningless number. It's devoid of any strategy, and it won't fool the public either.
But the former Health Secretary says today is a significant moment in terms of easing the lockdown.
This unlocks that key and, it will take time to get it up and running, but I think the Cabinet will have choices when they come to deciding about lifting the lockdown that they didn't have before.
One of Mr Hancock's advisers, Professor John Newton, was still insisting today mass testing earlier would have made no difference. Well, the Health Secretary is betting that now it will. Libby Vina, News at 10, Westminster.